we know chemotherapy is damaging the gut microbiome, but how could FMT be applied in a way that will improve the effectiveness of the chemotherapy and minimize the symptoms?
Hi, everybody. Thanks for joining us again. Today, we have a really exciting topic, and I will say this every time because I truly believe all of these topics are really exciting. And so I don't want you to miss any of these. So please subscribe, press the bell majiggy, and all the other things so that you can see what we're talking about and not miss any of the cool topics that we're going to cover to try to give you guys an in-depth idea of how the gut microbiome is playing a huge role in everything. That's the best way to summarize it. And I think this topic today will kind of hit on this. And it's the idea of the importance of the gut microbiome and targeting it or understanding it in terms of all sorts of treatments. The idea here is that the gut microbiome is integral throughout the body. And we want to kind of get the understanding the importance of the gut can help impact a ton of different approaches and conditions and medical treatments.
And I want to just set the stage here in a sense before you carry on and sharing more on this topic. And ultimately, I'm sort of imagining there's a clinic room, there's a doctor on one side of the desk, and there's a patient on the other side of the desk. And in many cases, if there's not an improvement in symptoms, both of them are feeling frustrated. One of them, being the doctor, doesn't know what to do anymore. They've tried all of their tricks, all of their protocols, and this patient just doesn't seem to be getting any better. And the doctor is questioning, is the patient actually doing what I'm telling them to do? Or am I a loser and don't know what I'm talking about, or have chosen the wrong treatments or didn't diagnose the patient appropriately? And then the other side of the desk is the patient who's struggling with whatever disease they're dealing with. And they're questioning after a certain length of time, a lot of money spent in many cases. And they're wondering, right? Does this doctor know what they're talking about? Should I be looking for another doctor in what could have been a stream of 5, 10, 20 different doctors, clinics, hospitals, etc.? And so what we want to talk today is about that dynamic that is existing in the room and how thinking about the gut in a new sort of reimagined way might solve some of the questions that both of these two people are unfortunately experiencing in that scene.
Thanks. And so I think the first thing to start is understanding how the gut is one of the main foundations of health. It plays a role not only in digestion, but immunity, inflammation, mental health, metabolism, skin health. And so we know it impacts the heart and the lungs and the liver. And so the idea here is that the gut is sitting in the middle of everything that's happening. And so appreciating that and understanding that the gut could be influencing not only the disease, but also the impacts of treatment allows you to maybe look at it from a different perspective of going, maybe there's a piece of the puzzle that needs to be re-regulated before treatments are going to work. Or maybe we'll get a better understanding of what the condition actually looks like when we remove the piece that is the gut that's dysfunctional on top of or as part of a condition.
And that's the thing. The symptoms are the presentation of what is ultimately the diagnosis. But the symptoms are not the thing that we need to be trying to target. They're just giving us information. And so if our goal is to just look at a symptom and look at all of the symptoms in isolation, we'll be lost quickly. The whole idea is you've got this big web that is your life, your health, and at the center is something. And there could be several layers to what this something or diagnosis is. But any diagnosis that exists out there is ultimately based on symptoms. And those symptoms could be by way of physical symptoms, like your skin is showing a certain thing, or it could be based off lab symptoms, right? If your labs are off, it's ultimately a symptom of something else, whether it's a hormone imbalance or whether it's a inflammatory marker that's elevated or what have you. And so the key is trying to take a step back for both the patient and the doctor and say, what's this big web trying to tell me? What could be at the center of this? Or what are the three things that could be lumped into one that we can then have a more practical view of this? It's just like the car when you got a dashboard on your car and it's beeping with a red light, like the problem's not the light, that's the symptom. The problem's actually something in the engine potentially, right? Like because you're hearing a weird noise, it's not the noise, it's what's making the noise, right? So you've always got to peel the layers back to try to understand what's going on. And I suppose that part of what we're trying to do here is like allow people to see this big web and see how everything is linked together. And we don't need to just have a purely like systems approach, like, oh, this is a liver issue, or oh, this is a skin issue. No, what if the skin and the liver and the gut are all linked? And by correcting what could be the foundational issue, we resolve all of them.
And I think too, understanding how much of an impact the gut has on regulating the immune system, and in turn inflammation, which we know can impact how treatments are going to respond. So by helping to, I don't want to use the word calm down, but I don't know if that's the best way to describe it, but get the immune system to chill out a little bit so that when you're adding more to treat other parts of the puzzle, that one is being helped along by kind of resolving the gut issue, which is helping to regulate the immune system. And I think we've said it's like, 70% of the immune system resides in the gut. So if you have an immune system issue, looking at the gut logically makes sense if so much of it is housed there.
Yeah, and that's the thing about the body, right? It's such a magnificent machine if we can make that parallel. It always seeks balance. And every system has like this pro and anti, whether it comes to your clotting system, your immune system, like everything, the pH in your blood. Some of these systems need to be so tightly regulated that if they fail by, in the context of pH in the blood, like if it fails by a 0.05, you're dead. So it needs to, for the life of you, needs to be moderating all of these things all the time. And so everything has a pro and an anti. There's always a balance that the body is seeking to achieve. And so it's pro-inflammatory, it's anti-inflammatory. But if it's too much of one, it creates a problem. And so the body is constantly trying to maintain balance in all of these systems to function optimally. But what happens is that when it's trying to maintain a balance in one part of the system, it can cause an imbalance in another part, right? Like let's just say you had low calcium always. The body's going to just start robbing. If your intake of calcium is too low, and it could be an intake issue or it could be an absorption issue. But if it's both an intake and an absorption issue, your body is just going to rob calcium from your bones. Like that's the next best thing to maintain the calcium balance in the blood, because if calcium balance is off, it affects potassium balance, and now someone's having heart issues, right? So the body is a self-preservation machine. It is always trying to survive, and it will harm you in a way, right? By stealing calcium from your bones. Now you're osteoporotic and you could fall over and crack your hip, but you're still alive, your heart's beating. And so it's really important in this context to be thinking about all of these things together. It's constantly trying to maintain balance, but sometimes maintaining that balance will offset another system, and or over time it'll deplete to the point where it can't maintain the balance anymore. It'll then present in symptoms. Using the heart analogy, like someone might be getting arrhythmias, like their heart rhythm is imbalanced, or they're getting real fatigue, or they're having like trouble doing exercise. Like all of these things are then symptoms. But what's beneath it all, right? Why is there this imbalance?
And I think this idea goes into like, why do we think the microbiome plays a role generally in impacting medical treatments? And I think that's twofold. Part of it is in turn, it is its own medical treatment, impacting or resolving gut issues can treat diseases, but also how the gut is, or what state of dysbiosis the gut is in, can impact how you respond to treatments.
Right. And if you're a functional, integrative, forward-thinking practitioner, the foundation of what you're doing is not anti, right? You're not trying to stop something. You're trying to support something. And so what are the interventions? I mean, typically it's going to be supplements. It's going to be herbs. It's going to be food. It's going to be sleep. It's going to be, ultimately those things. all of those things require a healthy, functioning immune gut and microbiome, right? Like you can take the best supplements that exist, but if you're not able to break them down and assimilate them into your body, what's the good, right? Like, what is the benefit of taking that expensive supplement? Or if it's food, right? Like, you could be eating all organic, but if it comes out looking only slightly modified from the way that it went in, we know it's not working. You're better off almost just eating a powder diet, right? Like, what's the point of expensive food if you're not able to digest and absorb it appropriately? And I think that's really, going back to the original setting of the scene. It's like, especially of fixing the microbiome and or gut dysfunction, which most people understand and appreciate is like the foundation of all health. But if you, as a patient or as a physician, have reached a plateau in the case where you maybe did a bunch of things in the beginning, things are working well, you're seeing improvements, and the patient's maybe like 50% better or 75% better, but there's still a 50 to 25% room for improvement, and you're trying everything and it's still not getting there, well, then I think you need to go back to the basics and rethink, okay, what foundational things are missing? And is this patient appropriately digesting and absorbing the nutrients? Do they have the right microbiome composition to help produce the all of the metabolites that are necessary to support health and vitality? And so I think it's especially useful in the context of people who have hit a plateau and or who are in a really seriously in a bad way, right? Like an example of this would be cancer. And I know we talked about this in our last podcast video, was about the use of FMT in cancer care and treatment. Someone who's dealing with an oncology case doesn't have time. They do not have time. And so everything they do needs to be implemented, and it needs to be done quickly and with the most information you can. But there's no such thing as like, oh, let's just take our time. Because we don't have time. More time means that, progression in the illness and or could lead to metastasis and so on. And so especially in those more severe cases, it's really critical to get the basics right. There's no time to be like, oh, maybe there's a microbiome dysfunction, maybe there isn't. Like, we need to assume that there is in these more chronic cases. But especially in those cases where the treatment has plateaued, the symptoms aren't improving further, we definitely need to rethink. And digestion, absorption, overall microbiome health is just absolutely critical to the rest of the body. And I think it's so easy to be like, oh, well, this is where I'm experiencing the pain or discomfort, or the skin symptom is like, oh, I've got a skin issue. It's on my face. My face skin must be the problem. And it's like, well, that's where the symptom's presenting, but that's not the problem. It could be a liver problem. It could be a gut problem. So that it's kind of like a systems approach, but breaking down the system even further to what is the foundation.
Yeah. And I think the other side is that the gut microbiome impacts how effective treatments are as well. And in cases like, infections, cancers, metabolic diseases, the list goes on and on. But how the gut microbiome's health can impact how effective that treatment is. And, from my perspective, one of the best areas, which we talked about recently, was cancer, because some people are non-responders to cancer treatment by restoring the gut. They are, but also some cancer drugs need a healthy gut to actually be processed and used by the body. So, not only is it part of the puzzle, but it also may be part of how well a treatment can work. And we've talked about this previously, but the idea that if you put something in the body and it can use it to solve a problem, but if the biggest problem is that the gut is dysfunctional, it may not go to the place it needs to. It's going to go fix that biggest problem, not the problem that you originally hoped it would. And the other side is that some treatments impact the gut microbiome. Antibiotics, chemotherapy, proton pump inhibitors, certain types of antidepressants and things will have impacts on gut health. And with that, you're treating something, but the medication is causing dysbiosis in the gut. And then that can then impact the time it takes for someone to fully recover post-treatment. So in terms of cancer, we know that restoring the gut helps with kind of side effects and kind of getting back to normal after treatment, but as well things like antibiotics and other kind of standard medications that are used commonly, they can impact the gut. And then that can then also impact how people kind of resolve symptoms or how they kind of recover from something.
Right. And then that's the context, right? Like sometimes people need those drugs, even though they're having, sometimes large scale, sometimes small scale impact on the health of the gut and the gut microbiome, but they're necessary to sustain the patient through whatever it is they're going through. And so I think it's important to not think of FMT as being on its own island. It's really a synergistic approach that can be applied with almost any intervention and still be safe and in large part effective. I mean, we've begun working more with doctors in the space of oncology, cancer care. And so we're looking at what is the research saying? How could you use FMT in the context of a patient who's receiving chemotherapy? Like we know chemotherapy is damaging the gut microbiome, but how could FMT be applied in a way that will improve the effectiveness of the chemotherapy and minimize the symptoms that a patient's feeling while going through chemo treatment? And that same thing could be applied. I mean, my background is as a naturopathic doctor, treated hundreds of patients using FMT. And often patients would think, well, I need to get off of these drugs that I'm on. It could have been prednisone or it could have been anything. And usually the indication was no, don't get off of all those things because you could fall apart. Right. That may be really critical to maintaining what is even your current poor health. And so the goal is unless it's like an antibiotic, I mean, it's going to be kind of futile to take FMT at the same time as an antibiotic, but immediately following or a few days following. And so the key is like restore your gut and gut health, improve your microbiome. And as those improvements are taking place, you're going to be seeing symptom improvement. And then in the context of, if we're speaking to a physician here, it's like you have this patient who's now in front of you seeing improvements through the interventions that you're doing to improve gut health. And then you can begin to taper off these other meds that may have been helpful, may have been doing nothing, may have been harmful, right? I mean, it's always really hard to know. And so that I think is the advantage of this, is it can be applied in a synergistic way to most any other modality that's being used, whether, ranging from everything from like conventional treatments that are up to and including chemo, to the other end of the spectrum with things that could have been, vitamins, minerals, could be stem cells, could be hyperbarics, could be, PRP, peptides, hormones, like all of the across that whole spectrum of care from totally conventional to alternative. This can fit in really well because it's truly the foundation that allows all of those things to be effective and or work better when your immune system, when your gut, when your hormones, when your neurotransmitters, when everything is working more optimally. It's going to improve the effectiveness of the intervention.
Yeah. And I think the scope at which we're learning about where the gut plays a role, but also where FMT can be effective, is growing regularly. We're starting to see, you know, um, outside of GI based diseases like IBD, IBS, C. diff, the growth in the use of FMT in non GI conditions is exponential. The number of clinical trials being done is exponentially growing. Um, and it's because it can be used on its own and in conjunction. But I think our understanding of the role the gut is playing throughout our body and in chronic disease has led to more buy in to appreciating the gut's role and then trying to support that in terms of on top of other treatments. And I think we're seeing it um, in things like neurological based diseases because we have such a great understanding now of the gut brain axis. We're still learning more, but it is a connection point that's been well understood. But we're now seeing more of these gut connections to other areas and then researching that if restoring the gut helps impact it. So we're seeing, in liver diseases and in heart, cardiological diseases, and then brain diseases, we're seeing growth in the use of FMT in conjunction with other treatments and not often just on its own. And I think that's something to appreciate, is that there's an understanding that it's going to work in synergy, or it's support, or it's fixing part of something that then can allow you to see what else is happening. And so I think that growth there is important to kind of appreciate, because it's not just that we know the gut plays a role, is that research is really supporting that. And based on those kind of initial positive results, that's growing as well. And so I think it's important to understand and see what your patients are bringing to you. What do we see in the research? Is the gut playing a role? And most likely the answer will be yes.
Yeah, I mean, you even talked about the gut liver, right? Like that's such a critical piece, and the liver is necessary for a lot of stuff, and it needs to metabolize everything. And there's a direct vein; it's the portal vein that takes stuff from the gut and sends it over to the liver. So it's this like gut liver axis, and it's to help transport nutrients as well as microbial metabolites. And the trouble though is that if if the gut isn't working properly and there's a leaky gut issue where the integrity of the lining of the gut isn't good, you're going to start to have inflammatory compounds leaking into the bloodstream, which then can contribute to what has become basically like the modern day illness of metabolic syndrome. And that typically includes fatty liver disease. Like previously, and I don't know the exact dates or timeline for this, but liver disease was only from people that dealt with alcoholism. Like alcoholics were getting liver disease. And then it was like, wait a minute, here's somebody who's not drinking a ton, but they're getting liver disease. Like their liver is literally getting fatty. And so they had to call it non-alcoholic fatty liver disease, NAFLD. And that's in large part because the gut microbiome is not healthy, and it's creating this really the ground, the foundation for what becomes metabolic disease, and that then just compounds further and further and further. And so now people are like most chronic diseases, people are thinking of them as being more of a metabolic issue, at least at the start, right? It started out as a metabolic disease, and the big killers, right, whether it be heart disease, which is often combined, if you have heart disease, you've got diabetes. Both of those are ultimately a metabolic disease. And so pretty much everything comes down to metabolism, and the gut and the microbiome play such a key important role in metabolism and supporting the organs in the body that metabolize. And the metabolites come from the digestive system, but the metabolites come through healthy, again, functioning microbiome. And so if you're not creating certain metabolites, you're going to be pushing the system in one direction or another. And in a lot of these cases, it's in an unhealthy direction. So, but I think, we could probably cover the gut liver connection in much more detail at a future video, but just to sort of touch on it, like it is just so critical, and detox through the liver is a really important detox mechanism. It's so critical. And a lot of people think about that, especially in the context of disease. Like typically people are in a disease state because they've had a buildup of toxins in their body through environment, through food, through the inability to remove them from their body, maybe due to genetic mutations or whatnot. But in large part, again, it comes down to the correct balance and overall health and well-being of the gut and the gut microbiome. So
Goes together. And I think it's that you'll see a trend as you listen to more of these episodes, but the idea here is that one thing can lead to another thing, can lead to another thing. So like you have a liver issue, but that liver issue might derive from a gut issue, and that gut issue may actually derive from your diet or the environment that you're in. And so going back to the car idea here, is that the liver may be the signal that you're seeing, the light, and that's what you're going to fix. But when you go in and start treating the liver, you're going to realize that, okay, so what caused this? Because it doesn't happen on its own. The body is a system. And so very rarely is one thing going to be the only problem. It's just not how it works. And so it's understanding that because the liver and the gut are so connected, we have to have an understanding of what's happening in the gut, because they're directly connected. And we're finding more and more ways that the gut is directly connected. And when you really break it down to the idea that Your body is fueled by the food that you eat. Your gut is the one doing all the work, breaking that food down and deciding what's going to be made next or what can be made from what it's been given. And then that goes to everyone else. Like all of the other organs, all the other parts of your body are fed by what the gut uses as building blocks to make other things. And I tend to look at everything from a brain perspective because I spent a lot of years only thinking the brain mattered. And I'm in a process. I'm unlearning that.
Recovery.
Yeah, I'm in recovery from being a neuroscientist and only thinking about the brain. But the gut, when we think about, and this is shifting, but for a very long time, when we thought about there is a mood issue, serotonin, we've got to fix serotonin. But almost all of the serotonin in the body is made in the gut. So we were trying to fix a brain issue before we really understood that the gut and the brain could talk at all. We were trying to fix a brain issue, and what we were doing was flooding the gut with serotonin. And so when you think about the gut being connected to the brain, for me at least, we think of our brain as doing all of the high level stuff, all of our thinking. It makes us who we are. It holds our memories, makes all of our decisions. But one of the driving factors for how well the brain can work is the gut. So if you want to think about why the gut is so important, if you think about yourself making decisions and remembering things and how you feel as being the most important thing, well, most of that is coming from the gut, or the gut is playing a really big role in that. And if you doubt it, think about it, brain fog. Brain fog isn't just coming from the brain,
Yeah.
right? So part of the importance is how we define ourselves and how we think about us as being successful beings on this earth. It's more driven by the gut or in conjunction with the gut than just our brain. And so I think when you start teasing that apart and you think about why it's connected to everything, well, it makes sense because we've always thought about the brain being the driving force for everything else. Well, the gut's in the car, at least. I don't want to take away that the brain's not doing everything. I'm not fully recovered yet, but it is playing a really big role. And so when we start looking at chronic disease, if you really boil down where things are coming from, either be it early symptoms before someone was diagnosed, or when you lay everything out on the table to what's actually happening, the gut seems to be tied into a lot of places. And part of that can be from with dysfunction just within, dysregulation or dysfunction in the gut, but also lifestyle can impact the gut, but also chronic disease can impact lifestyle, which can impact the gut. So it's not always going to be the gut, the chicken of the egg of it, I guess. Did the gut come first, or is the gut part of the, added in? But understanding that it's sitting in the middle of it all, and it needs to be kind of noticed, and it can help with making things effective, but it can also help regulate the systems so that they can be responsive to treatment as well.
Yes. What a maze. What a fun maze. And I mean, that's ultimately, right, again, we're going back to that scene, right? You're the physician sitting there and you've got a patient across from you and you're struggling to think what's the next step, right? In this maze of getting this person back to health. And, you're debating whether or not you're referring them on to someone else, or you're going to try a different protocol and you're thinking, well, how can I sell them on this protocol? And I don't mean like monetary wise, but, you've got to convince or at least present an argument as to why this is a good idea. And I think if you haven't spent much of your intervention, whether it be dietary or rebuilding the integrity of the gut and rebuilding the gut microbiome, I think this ought to be a core piece of your consideration. And not everybody needs to start with FMT, but in a lot of cases, it can be an amazing synergistic treatment that'll improve the outcomes, and it'll do it all much faster than the other stuff. Now, even doing FMT, I mean, that's not the end of the road. You need to continue to support this new gut and new microbiome, right? Like, you can't go back to the old way of doing things and expect to get new results, right? Like, once you've rebuilt the gut microbiome, whether that's through FMT or other things, you still need to support it. And all the other things that we continue to talk about, whether it's diet, whether it's sleep, whether it's exercise, all of those things are going to be an important aspect of maintaining the gut and continuing to be, on this trajectory of improved health. And that's like ultimately at a certain age, you're in a decline. We're all in a decline. And to maybe end this off, like most people, when you reach a certain age, you're thinking, okay, how can I live longer and how can I live better while I live longer? Right? It's not just about living forever. It's about living and feeling awesome for as long as that forever you can have, whether you live to 70, 80, or 100, right? And so thinking about the fact that we're constantly on a decline at a certain point, I don't know when that is, the brain and, all of the organs honestly are on a different time rhythm as far as where the decline is and how quickly it happens. And your diet and your lifestyle and your genetics and all of the other things will affect the decline. But thinking about the microbiome as being the one thing that you should keep fine tuned so that all the other things don't decline nearly as quickly is going to be key. And so that's a big part of where the microbiome comes into play. Like the microbiome declines with age. This is why we choose young, healthy donors. We don't choose old, healthy donors because we know their microbiome is not going to be the same as someone who's younger. And so we choose a younger donor to try to sort of replicate what's working in a younger person. And we, some cases we're treating young people, in some cases older people are getting treatment. But ultimately the goal is to try to maintain the health of the individual systems, knowing that they're all linked together. And by maintaining what is ultimately the foundation, you're going to improve quality of life, longevity, and overall health and well-being, both in the present and hopefully in the future, preventing the onset of many of these diseases. So that's it for me. I look forward to the next one. I think this was fun. As always, we love feedback from you guys. So if you're a patient or you're the doctor, we'd love for you to leave comments below. Let us know what resonated about the topic, any other topics you'd like to cover. Anytime there's comments, we get notifications and we can review them. So leave a comment. It really informs what we want to cover. And then, as always, if you are a doctor and then you've enjoyed this, we'd encourage you to share it. If you have an audience, share it with your audience and or with a doctor network. Like, we're really trying to get the word out and create content that's meaningful for anybody who's in that, scene I've continued to describe. We really want to help spread the message of the importance of gut health and how it interacts with everything else in the body. And FMT is just one piece of what can be a really transformative part of any treatment plan.
Yeah. And I think the future of medicine, might be part in the gut and in microbiome-based therapies. And I think what defines a microbiome-based therapy will continue to change. And that's the kind of world we play in. And we're, keeping on top of those things. But we're seeing a shift and better understanding of towards this idea of personalized medicine and preventative medicine. And I think in both of those cases, the microbiome-based therapies are going to play a really big role. And understanding that the gut plays a role and how that could be targeted in treatment.
And I'll go a step further. It is the solution. I don't think it is. I'm willing to plant a flag here. I think this is the future of healthcare, is through, again, precision, but using microbiome therapeutics. It's clearly the future, and our understanding of how everything links back to the gut. There's just no question that fixing gut dysfunction is going to be the future. And I think it'll lead to both the resolution of many chronic diseases and ultimately my overarching goal is, how do we prevent all of this stuff from happening in the first place? And I don't think we'll ever get to a world where we're like, oh, wait a minute, it was the lungs after all that were the cause of all of these chronic diseases. There's nothing truly that links back to everything like the gut does. And so the more, time that we spend looking through all the research, and, me having had spent many years in clinical practice, it's just hard to not see that this is the foundation of all health. And again, we need to understand a lot more of how to personalize and individualize the approaches. This is the future. So come on for the ride.
Yeah, join us. And if you're a medical professional and this sparked your interest, but you have a lot of questions, reach out to us. We love answering questions.
Yes.
We love having these kinds of conversations with not just the two of us. We like to bring friends. We have lots to talk about. But we're here to answer your questions. And if there's a topic you want to talk about, like Jason said, comment. It'll give us something to talk about next time, because we only want to talk about things that people find interesting and helpful, because the goal is to educate. So if you have something you would like to be educated on, leave a comment and we'll jump on that topic. Thank you guys so much. And I hope you guys join us next time. And thank you for everything, Jason, and all of your insights.